good day, my people. My name is Dr. Raji, and you are welcome to Integrative Doctor. Today, I'm going to be talking about some of the most important tests to be carried out at least within the interval of a year at different medical labs or different hospitals out there. I've seen that many conditions turns into terminal ailments as a result of the fact that many are not used to doing a checkup, and of course, our body, once we have a particular condition and is not being taken care of well, it can transcend into a broader issue. Just imagine if you have a car and then you are using the car. Of course, you know that you must change the engine oil, you must buy fuel and different other things. It is so for the body as well, because you must always check over your body at regular interval through some diagnostic procedures. We now have different diseases that are particular to male, and we have some that are particular to female, and we have some that are general. For instance, diabetes in general, it can happen to either male or female. Let me start from female. As a female, at least you must always carry out hormonal profile test, or what we call hormonal assay, once in a year. Parameters we are going to be noting under this hormonal profile test is just prolactin, progesterone, estradiol, and different other hormonal markers. And there are some times whereby you may be having hormonal imbalance, and of course, through these hormonal profile markers, it may indicate some things, whether it is actually high or not. It is very, very important to carry out hormonal profile tests at least once in a year, so that you'll be able to check your hormonal levels, whether your prolactin is high, the one we call hyperprolactinemia, or whether it is low, or whether your progesterone is high, whether it is low, and some other hormonal markers under the hormonal profile test. Also, as a female, you must always try and be carrying out what we call mammogram or breast scan. We always advocate that female should be checking their breast examination as often as possible. Because of what? Because of breast cancer, which is very, very, very rampant nowadays. And breast cancer, it's happening to younger generations, it's happening to older generations. Very, very important to carry out this mammogram breast scan at least once in a year. Once you go to a laboratory, you do the test, you run the test, and then of course you get in touch with your personal doctor so that you will be able to interpret the result for you. Also, we have abdominopelvic scan. Some people must be familiar with this, while some didn't know it because of lack of regular checkup, especially for abdominal ultrasound. So other men or women can carry out this abdominopelvic scan, and under the abdominal scan, what we are looking for, we are going to be checking your liver, we are going to be checking your pancreas, we are going to be checking your spleen, we are going to be checking your kidneys, both kidneys, whether they are okay or not, whether we are having hydronephrosis, pyelonephritis, or different other kidney related conditions. Once you carry this out every 6 months, it's very, very okay. And under the pelvic scan for female, it's very, very important to know the status of your pelvic region. Part of them is your uterus, that is your womb, whether you're having fibroid, uterine fibroid, or different other uterine hydration and different other female related condition. Also, your ovaries, is very important to know the status of your ovaries as well. That is your egg reserve area. Under this, we are going to check whether you are having ovarian cyst or polycystic ovarian syndrome and any other ovarian problems. There are a lot of things to be checked under this abdominopelvic ultrasound, and at least as a person, you must always try and carry it out every 6 months. For male, yes, it is very, very important. All those aforementioned organs like liver, pancreas, spleen, and different other kidneys, abdominopelvic ultrasound is going to bring that out. As a man, you can always do prostate scan separate. That is, can be done once in a year. Also, as a man, it is very, very important to always carry out PSA, that's prostate specific antigen tests. If you are above 50, it is very, very important for you to carry out what we call prostate specific antigen test, so that you'll be able to know your status, because it has a range from 0 to 4 nanogram per ml. Also, we have some general tests. Either male or female can actually carry them out. One, we have full blood count. Under the full blood count, we are going to check your red blood cell, we are going to check your platelet aggregation, we are going to check your white blood cell. That is where we are going to know whether your immune system is optimized or not. I've made a video about the immune system, so you can go and watch my former video so that you will be able to know what we are talking about. Also, you can know whether your blood percentage is very, very okay. That is the one we call PCV, under the full blood count. Then another test that is general to either female or male is what we call EUCR, that is electrolyte, urea, and creatinine test. We are going to be checking some of your electrolytes, potassium, like sodium, bicarbonate, urea, and creatinine. So this EUCR is going to be checking all these things, whether your electrolytes are well balanced and whether your kidney is functioning very well. Also, LFT, which is called liver function test, is also very, very important for a man or a woman to be carrying it out at least once in a year. And there are some people that have hepatitis, there are some people that have liver related problem or kidney related problem. You should always carry this test out, either for the kidney function test or for the liver function test. And of course, you should have a doctor that will be guiding you forth. But it is very, very important to be doing general health checkup every year. There are some other vitals that are very, very important that, in fact, you won't need to go to any laboratory or any hospital to carry that out. You can always do it at home. One, your blood pressure level. You must always know your blood pressure level. You also need to be checking your blood sugar level. This one, it is very, very important. If you know that you are in a family whereby your dad or your grandparents had diabetes, you should always be careful, and you should always be checking your blood sugar level interval to interval. And sometimes you may even decide to carry out what we call HbA1c. And I have made video on diabetes. You can go and watch this on Integrative Doctor platform. Thing that many people don't know is that they should always check their urine. There are a lot of markers in urine. Your urine may indicate that your kidney is having problem. That is where you're having proteinuria, when there is protein inside your urine. There are some people that when they are urinating, the urine will be very, very, very foamy. That is a sign of protein in your urine. And when there is protein in your urine, definitely you are having probably glomerulonephritis or different other kidney related conditions. And the sign of liver problem can also be shown under urine alone. If you are having diabetes, it can show in your urine. If you are having blood within your urine, there is a problem. Maybe you are having infection or different other things. All these tests, they are very important to know and then to be familiar with, so that we and our family, we are going to be doing a regular health checkup. It can be very, very problematic and thereby cost one's life. Comment on this video, share, and follow this page, Integrative Doctor. Thank you.